Ebola in the U.S. A new case shakes up the way America responds to the virus. And if Ebola wasn't enough, could the outbreak lead to a food crisis in West Africa? And a troubled actress is in crisis again. We'll tell you why. Africa 54 starts right now.
Hello and welcome. I'm Vincent McCory. This is Africa 54. America's top disease control official says the first known transmission of Ebola in the U.S. dictates a rethinking of protocols to protect healthcare workers and the public from the deadly virus. The new case prompted President Barack Obama to adjust his schedule in order to receive an Ebola update from senior officials. VOA's Michael Bowman has more.
Concern about the new Ebola case extended to the White House, where President Obama invited cameras into a hastily arranged briefing on improving the U.S. health system's preparedness. Earlier, hazardous materials workers cleaned out the apartment of the infected Dallas nurse, who is now identified by family members as 26-year-old Nina Pham. The director of the U.S. Centers for Disease Control and Prevention, Thomas Frieden, addressed an increasingly alarmed American public.
Stopping Ebola is hard. We have to rethink the way we address Ebola infection control because even a single infection is unacceptable.
Precisely how the nurse became infected is unknown, whether through human error or a failure of protective gear or hospital protocols. Frieden said he cannot rule out the possibility of additional cases being detected and announced an extensive urgent campaign to alert and safeguard the nation's medical staff in hopes of preventing further transmission of Ebola.
People on the front lines are really protecting all of us. The enemy here is a virus, Ebola. It's not a person. It's not a country, it's not a place, it's not a hospital, it's a virus. And it's a virus that's tough to fight. But together, I'm confident that we will stop it.
Several U.S. airports are strengthening health screening procedures for passengers arriving from 3 West African nations. That may not be enough, according to Republican Congressman Michael McCaul, who does not rule out temporarily halting U.S. visas granted in parts of Africa.
And the American people are rightfully concerned. They are concerned because the Ebola virus is an unseen threat, and it is only a plane flight away from our shores.
Mounting fears extend beyond countries that have registered Ebola cases. Israeli Prime Minister Benjamin Netanyahu.
This is a global epidemic. We are cooperating with other countries, in addition to preserving our borders.
But panic is unwarranted and unhelpful, according to Dr. Ian Smith of the World Health Organization.
Fear of infection has spread around the world much faster than the virus.
Amid mounting anxieties, some possible good news. Russian health officials say they have developed vaccines against Ebola that are ready for testing. Michael Bowman, VOA News, Washington.
Well, a Sudanese UN medical official fighting the Ebola virus died on Tuesday in the German hospital where he was being treated after arriving from Liberia last week. The St. George Hospital in Leipzig says that the 56-year-old official died overnight Tuesday morning. The medic, who has not been named, was the third Ebola patient to be treated in Germany. Hours after the man arrived in the eastern German city, a doctor at the hospital told reporters the patient's condition was dire, even though he may have been seen walking at the airport. In Britain, critics are questioning the government's response to the Ebola outbreak following delays and indecision over the introduction of a screening process. Britain's chief medical officer warns the country should expect a handful of Ebola cases in the next few months. Henry Ridgewell reports from London.
Britain is bracing itself for the arrival of the Ebola virus.
Yeah, I've just been feeling unwell over the last few days. I've not long come back from Sierra Leone.
This 8-hour nationwide drill Saturday was designed to test the health system and government response. Britain's Health Secretary announced Monday that screenings would be introduced for passengers arriving from the worst-hit countries of Liberia, Sierra Leone and Guinea.
This will allow potential Ebola virus carriers arriving in the UK to be identified, tracked and given rapid access to expert health advice should they develop symptoms.
Some medical experts dispute the effectiveness of screening. Tom Solomon is a professor at the University of Liverpool.
This is a disease which has an incubation period up to 21 days. So if people have symptoms when they leave a country in West Africa, that will be picked up. And there's very little to be gained additionally from screening people again 10 hours later when they arrive in the UK.
Britain said last week it would not introduce screening, but then reversed the policy. The government response has been inconsistent, says Sophie Harman of Queen Mary University of London.
Reactionary, haphazard, and yet again another U-turn.
But Harman says Britain's National Health Service is capable of dealing with an Ebola outbreak.
If a case of Ebola does come to the UK, and increasingly we think that is going to happen, we do have a robust health system to deal with this issue. And I think that was an important message that the government has slightly lost by introducing these kind of border restrictions, which are quite facile at best.
Any Ebola patients in Britain will be taken here, the country's only high-level isolation unit at the Royal Free Hospital in London. Doctors at the hospital, like Stephen Mepham, say there is no need for the British public to worry.
Britain is a very different environment to West Africa, and it's inconceivable to think that the virus could travel in the same way as it has in healthcare settings in West Africa.
Workers for Britain's National Health Service staged a 4-hour strike Monday over pay. Christina Macania of the Health Workers Union says government cuts could undermine the airport screening programme.
Due to cuts in NHS funding, that the health staff who work at airports are actually being cut.
The government insists the country is well prepared. Health professionals say it is very likely the disease will soon arrive in Britain. Henry Ridgewell for VOA News, London.
On a battalion of 800 soldiers awaiting deployment as peacekeepers in Somalia are now under quarantine after one of its members tested positive for Ebola. Spokesman for Sierra Leone's armed forces says the soldier was infected after leaving the military camp where the force is based without permission. The soldiers were due to relieve the nation's contingent already deployed with Somalia's African Union peacekeeping mission, AMISOM. They will now be subject to a 21-day isolation period. In North Africa, ISIS and the Middle East were high on the agenda as Egypt's President Abdel Fattah al-Sisi met with U.S. Secretary of State John Kerry. The Obama administration also raised concerns about restrictions on Egyptian civil society. VOA's Scott Stearns reports from Cairo.
Egypt's protest law allows authorities to ban any public gathering of more than 10 people. It's one of the measures blocking the full restoration of U.S. financial assistance to the new government, which continues to detain journalists and many members of the former ruling party, including Egypt's ousted president. Secretary Kerry says such restrictions on civil society continue to be part of his talks with officials here in Cairo.
The foreign minister and I also discussed, as we almost always have, the essential role of a vibrant civil society, a free press, due process under law. And there's no question that Egyptian society always has been stronger and is stronger when all of its citizens have a say and a stake in its success.
Former General Abdel Fattah al-Sisi led the coup that toppled Egypt's first democratically elected leader and was then himself elected president. He told the UN General Assembly last month that he's committed to reform.
Our aim is to build a new Egypt, a state that represents the rights and freedoms, honors its duties, and ensures the coexistence of its citizens without exclusion or discrimination. A state that respects and enforces the rule of law and guarantees freedom of opinion.
Yet some say al-Sisi must do more to show he's serious about those reforms. American University professor Akbar Ahmed.
General Sisi has to very quickly establish himself as a wise, sensible leader if he has to gain any credibility in the near future, because otherwise he will have to be constantly battling this reputation of having come in as a military dictator at a time when it seemed, after the Arab Spring, that the time of the military dictators was over.
Many members of the former ruling Muslim Brotherhood remain behind bars, as do other critics of the al-Sisi administration. Human rights lawyer and former presidential candidate Khaled Ali says President al-Sisi is misusing the law.
For example, people took to the streets to show support for Sisi. Others took to the streets against Sisi. Those who were supporting Sisi were protected by the police and could not be touched, while those who were protesting against him were arrested.
Egypt is an important part of resolving the Israeli-Palestinian conflict and of fighting Islamic State militants. But Human Rights Watch's Sarah Margon says Washington cannot let that obscure its push for civil liberties.
Down the line, having human rights, basic fundamental freedoms, expression, association, assembly, those are all integral to national security. And if you look only short term, you're much more likely to cloud the longer term prospects for peace.
As Cairo tries to broker a more lasting peace between Hamas and Israel, U.S. officials say Egypt's leaders must also meet the needs of their own people. Scott Stearns, VOA News, Cairo.
Well, back to the U.S. Some police officers in Washington, D.C. and New York City have started wearing body cameras. The goal is to reduce the use of force by officers and complaints from citizens. But they are not the first to do so. As VOA's Chris Simpkins reports, police in many smaller communities are already recording their daily interactions with the public.
Alfie Akol is one of 32 officers on the Laurel, Maryland police force outfitted with a body camera. Zachary Berry has one on patrol with his police dog.
The camera here on my sunglasses, they also make a headband that goes around back for if it's nighttime. That's exactly what takes the video, and it has the microphone.
Laurel was one of the first police departments in the Washington, D.C. area to use body cameras. Chief Richard McLaughlin launched the program.
It's not only a protection for the officers, it's protection for the general public as a whole. It holds people more accountable.
Police officers in Laurel, Maryland have been wearing body cameras for the last 2 years. So far, the reports are positive. Chief McLaughlin says the video protects citizens from excessive uses of force by police. But officers can also use the pictures as evidence against any false charges of using too much force.
Our use of forces have decreased. Complaints have decreased. This is the incident in its entirety. It's a rebuttal for the police. It's a rebuttal for the general public. It holds people more accountable. It changes attitudes. It makes people more responsible.
The controversial fatal shooting of unarmed teenager Michael Brown by white police officer Darren Wilson in Ferguson, Missouri last August touched off days of riots and renewed interest in police body cameras. Many in the city demanded to know exactly what happened. Now some Ferguson police are wearing cameras, but people across the country have mixed feelings about them.
If it's a situation and it's going to really bring it to the forefront what really happened, then yes, I'm for it.
I think body cameras are a good thing to wear. I think it's protective both for the police force and the citizens.
A lot of times that's invasion of privacy.
Body cameras are used by more than 1,000 U.S. police departments. To address privacy concerns, officers inform people they're being audio and video recorded in public. But inside home or businesses, the officers ask permission to keep the camera on. Police are also testing cameras in Indianapolis, Indiana.
A citizen sometimes files a complaint, again, with no video evidence. It's the officer's word against a citizen. Well, now we have a third impartial view of what happened.
Police across the country are hoping the devices will improve accountability on both sides of the lens. Chris Simpkins, VOA News, Laurel, Maryland.
We want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com. Coming up in today's health segment, how the spread of Ebola could lead to a food crisis. Stay with us.
President Obama recently delivered a statement to West Africans in support of the international fight against Ebola.
On behalf of the American people, I want you to know that our prayers are with those of you who have lost loved ones during this terrible outbreak of Ebola. Along with our partners around the world, the United States is working with your governments to help stop this disease. If you feel sick with a high fever, you should get help right away. Because with prompt treatment in a medical center, nearly half of patients can recover. Stopping this disease won't be easy, but we know how to do it. You are not alone. Together we can treat those who are sick with respect and dignity. We can save lives, and our countries can work together to improve public health so this kind of outbreak doesn't happen again. In this urgent work, and in building a stronger and more prosperous Africa, you'll continue to have a partner in me and in the United States of America.
Welcome back. Joining us now is Africa 54 health correspondent Lino Moodoo with a look at how the Ebola outbreak might create a food crisis. Lino.
Hello, Vincent. The threat of hunger is tracking closely behind the spread of Ebola across the affected West African nations. As the disease kills farmers and their families, well, it is also driving workers from the fields and creating food shortages. The UN Food and Agriculture Organization says the world's worst Ebola epidemic has endangered harvests and triggered soaring food prices in West Africa. The FAO says restrictions on people's movements and the establishment of quarantine zones to contain the spread of the hemorrhagic fever have led to panic buying, food shortages, and price hikes.
The people who used to work the fields are not working the fields. The people who used to drive the lorry are not driving the lorry. So some of the impact of this health crisis goes beyond just health. It's now affected the fiber of society.
Since it was first reported in the forest region of Guinea in March, Ebola has killed more than 4,000 people. It crossed into Liberia and Sierra Leone and has triggered smaller outbreaks and cases in Nigeria and Senegal. As governments from the United States to China and Cuba sent troops and medics to the affected corner of Africa in an attempt to contain the epidemic, relief agencies are scrambling to ward off the humanitarian crisis threatening hundreds of thousands along with the health disaster. The Ebola impact is wrecking rural farming areas in Liberia and Sierra Leone, which are still recovering from the civil wars of the 1990s. Agriculture drives economic growth in all three countries hardest hit by Ebola.
What you're having here is going from a health emergency to really a humanitarian emergency, food security issues, or insecurity, I should say, which is affecting people's ability to nurture themselves or their families. And so some of the aspects that we are seeing with this human tragedy is now having a ripple effect throughout all of society. And two of the three countries in West Africa have just come out of civil wars. So some of the security and the stability is of concern and needs to be monitored.
The World Food Programme is trying to provide food to around 1 million people in Liberia, Guinea and Sierra Leone, and the FAO warns the problem is likely to intensify in coming months. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Lino, thank you very much. And now be sure to watch Lino Moodoo's Health Reports every Tuesday and Thursday right here on Africa 54. Well, more and more Africans are communicating via text, social media, and email. In Senegal, literacy experts are using new technologies to motivate and teach women to read. The UN Educational, Scientific and Cultural Organization, UNESCO, rolled out the program there in 2012, but is now expanding it to as many as 6 other African countries. Christine Robbie reports from the Pekin suburb of Dakar.
Mariama Dafe is learning to write and work with numbers. She started this at-home study program a year ago at the age of 39. UNESCO partnered with the Ministry of Education to create these literacy modules. They run daily on state television. Some days it's counting, other days it's spelling. The women who are taking part say the lessons have made them more independent.
These days I have my mobile phone and I can read messages and I can send messages too. And I don't have to go to anyone else to give them my mobile phone to read it for me.
Mariama says the lessons are convenient. She fits in 3 modules a week while also working full-time and taking care of her 3 kids. Senegal has limited funds for literacy. At-home study programs are cheap and easy to manage. Some women do prefer the classroom. The women here practice in Wolof and in French. At least 2/3 of illiterate adults in Senegal are women, but Aistou Keita, who's 39, says it's never too late.
My kids laugh at me. They think it's funny that I started learning at this age. When I make mistakes, they correct me. But I feel very proud of it and I have nothing to regret.
Instructor Mamadou Diallo says the women love the interactive display wall.
J'étais émerveillé et étais pressé de découvrir. Quand je leur disais qu'attendez un peu,
the first time they saw it, they were mesmerized and anxious to try it. I told them, wait, first we need to work on the chalkboard before we can start the math. It has been a joy for them to learn how to use new technology.
Mamandak Mboup is treasurer for the classroom business. The women buy food in bulk and sell it for profit. They practice these transactions in the classroom.
We started with about $100 and we go to the market. We buy onions in bulk at $1 a kilo and we sell them for $1.20 a kilo. We keep the profit and we return the dollar to the group. We keep on doing it. So far we have earned $700.
The classes are free and the women can come as long as they want. UNESCO is now expanding the program to Kenya, Nigeria, and the Gambia. Kristen Roby for VOA News, Peking, Senegal.
Well, it's time now for a short break. Still to come on Africa 54. Well, look who popped up at a Comic-Con in New York. We'll be right back.
If you've just joined us, I'm Mariama Diallo, and here is a quick recap of today's headlines.
In Liberia, healthcare workers strike demanding more pay for the high risk of working with Ebola patients. In Madagascar, former President Marc Ravalomanana is arrested after returning from exile in South Africa. In Nigeria, protesters continue campaign for the release of schoolgirls abducted by Boko Haram 6 months ago. In South Africa, defense attorneys for Oscar Pistorius appeal to judge for leniency in sentencing hearing, saying prison will, quote, break him. Finally, in Morocco, protesters gather outside parliament to demand abolishing the country's death penalty.
That's it for today. Thanks for watching. We'll see you next time.
Well, time now for what's trending on Africa 54. The madness of actress Amanda Bynes. Now, the troubled former teen star is back in involuntary psychiatric care in California. Amanda, who has become known in recent years more for her legal wars and bizarre public behavior than her acting, was placed under so-called involuntary psychiatric hold last week. The development came just hours after the actress took to Twitter to accuse her father of sexual improprieties. Later, she tweeted a retraction, blaming the comments on a microchip in her head. Well, next in the land that loves trends, cross-dressing comes out of the closet in Tokyo. This is Rumi. The hair, makeup, and clothes are all part of his life outside work. During the week, Rumi is a businessman who is married with 2 children. But every couple of weeks, Rumi comes to dress up at this photo studio in Tokyo. And cross-dressing has made its way into business too. Now, 5 years ago, a cross-dresser who goes by Chi Aki opened a new type of maid cafe where the maids are in fact men dressed like women. It is still the only maid cafe of its kind in Japan, but business is brisk even on weekdays. And finally, isn't George Clooney supposed to be on his honeymoon?
So really uncomfortable.
Well, the Oscar-winning actor, director, and newlyweds surprised fans at a Cannes panel discussion about his new Disney film, Tomorrowland. Clooney revealed this was his first time attending the so-called nerd conference, saying, "On top of it being my honeymoon, I'm a virgin." He later joked that his panned Batman performance was the reason why he had never attended, and that is what is trending today. Well, New York's annual Comic-Con showcases the best and the brightest of comics, video games, film, and television. Many visitors dress up in costumes, get into character, and interact with the other diehard fans. VOA's Daniela Schreier was there.
Thousands of comic, sci-fi, and fantasy fans descended on New York's Jacob Javits Center for the annual Comic-Con convention. Adults, children, families, even babies dressed up like their favorite characters.
I came to crush the Fantastic Four. I hear they are here somewhere.
Cosplay, short for costume play, is the practice of dressing up and sometimes even embodying fictional characters. Stacy came as a popular anime character.
Well, I'm Sailor Moon, and this is the rest of the Sailor crew.
They paid attention to the little details to get their cosplay just right.
We spent a lot of money just trying to get the outfit together and the shoes, and I would say we were planning at least for a few months to try to get everyone to look coordinated and what we were supposed to look like.
Security is tight, and even superheroes have to get screened.
My name is Danny, and I'm dressed up as Fasha from Dragon Ball Z.
Denny traveled halfway around the world.
Well, I'm from Australia, so it took me like maybe 22 hours flying time to get here, something like that. And yeah, I'm really excited. I booked everything last year.
It's a good time, but not without its hazards.
So far, it's been great. I'm sweating a lot, but other than that, it's great.
Comic-Con runs through the weekend and features panels with creators and stars, as well as sneak peeks at anticipated films and games. Daniela Schreier, VOA News, New York.
And that's our show for today. Thanks a lot for watching. Have a good night.
Welcome to the Voice of America's Newswords. This word often is used when talking about something that is written.
The revisions began in 2016 for the 1.5 million students who take the SAT each year.
A revision is a change that corrects or improves something. This story is about the SAT, or Scholastic Aptitude Test, that high school students take to get into American universities or colleges.
The company that gives the test is changing words and information on the test. Another example of revision is when a document is changed before it is published.
Now, when you hear the word revision, your American English will be good enough to know what this news word means, and you can use it in a conversation.